we're really finding some incredible information when we combine the well-being index data with the well-being assessment data, and then working with some of our larger clients. And what I'm finding particularly fascinating is we're really validating that when you impact all 6 areas of the well-being index, that it certainly correlates well to cost reduction. For instance, when we correlate people with higher levels of well-being to the cost of healthcare, what we see is that for every point higher a person's well-being is, their healthcare costs are on average 1% less. And so that's very significant. Likewise, we're seeing a very good correlation between well-being and things like your personal performance at work, your amount of unscheduled PTO, your intention to stay with your current organization, your engagement at work, and even when we convert it to teams, we're seeing that the teams that perform the best in companies have the highest average well-being scores, even right on down to their financial performance. And so we're really seeing some amazing information come out that we think will really help guide us in helping companies maximize their value proposition by impacting the well-being of their people. Just as a few other examples, for every 10 points that you can move the needle on the well-being assessment in overall well-being, we're seeing a correlating amount of healthcare cost savings to be about $409. Also 11% reduction in unscheduled absences, and actually 3-point higher engagement at work. If you drill down to just the physical health area and people's chronic illness and associated illnesses, what we find is that for every 10 points we can move the needle in the well-being assessment there, we see a $521 improvement in the cost of health care and a 6% reduction in their unscheduled absences. And even when you get down and look at things like work environment, for every 10 points we move the needle with the well-being assessment there, we see a 2% increase, or I'm sorry, a 2-point increase in people's actual engagement at work, and 5% higher willingness to stay with their current organization. And then finally, even with basic access, when we move that needle 10 points, we see things like unscheduled absences going down. We see improvements in their healthcare utilization patterns. And so just a lot of very interesting information that's coming out of this. For Healthways now, our efforts are to say, how do we move the needle the most points the quickest? What will be the corresponding movement in their cost and their performance, both at work and in their personal lives? And what's the latency between the time that we actually move these indices and the fact that you get the payback both in terms of performance and cost reduction?